Fever is one of the most difficult things that parents have to deal with their babies and children. But fever is really a biological response to what is usually a viral infection. And basically, our body wants to change its environment to make it less hospitable for that virus to grow. And as it slows down its growth, it allows your immune system to respond and to create antibodies that will suppress and minimize the degree of infection. Fevers generally are not harmful. It's very rare that a fever can go high enough to actually injure a child. A child can be very uncomfortable with a fever, and often that is what we address when we try to treat it. Actually, fever is a symptom. It's not a condition. It's not the disease. And it is mostly what it does to our bodies and our mood that sometimes warrants that we treat it. Most important to realize when you have a baby is that fevers are not acceptable in the first 2 to 3 months of life. Anything over 100.3 we consider an issue that needs to be addressed by your pediatrician. So if your infant picks up a fever and you've documented that, call the pediatrician, make sure that we understand what's going on. It's a time when we often will require a visit to the office to examine a baby. Children older than that may be very irritable and upset when they get fevers, and we often will offer them some ibuprofen or acetaminophen to help with those symptoms. But it's not always necessary. 101 temperature in a child who's otherwise happy and comfortable is not necessarily something you have to treat. Fevers don't always respond immediately to these medicines, and understanding the cycle of fever, which is one that our body has a very intrinsic ability to control, doesn't always allow us to have the immediate response that we'd like to see. Let air circulate over the baby or child's body, because that's helping us control our temperature more than anything else. Air convecting over our body will take that heat from us and allow us to cool down. So fever can be scary. It can be something that parents get very upset about, but it's often something that is actually good for your child when they do get an infection, helps them get better. If you have any questions, certainly call the office. vapg.com, our website, will have doses for those medicines and help guide you through these times of difficulty. Check out our website at vapg.com, where you will find out all kinds of information about your children through educational resources, videos, as well as learn about our offices and how to connect with us.